Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations Tonight with Marty Ross MD. It's a webinar where we're going to talk about Lyme disease. I'm interested, as usual, to see what you have in store for me. Although all of you write your questions to me independently, sometimes we get into a theme of the night. So we'll see what occurs here this evening. For those of you that are new here, welcome. And the way that you can participate are two ways. Number one, you can write questions to me. The second way you can participate is to just listen to the questions as I read them and the responses that I give as well. Previously, the last webinars, I have been requesting everyone to write their questions to me using the chat box that's located on the bottom of the right-hand side of the screen. But I was asking them to also click on the question mark. I'm no longer requiring you to click on the question mark. You could just write your questions to the regular chat box down there. I know a number of people have been having problems getting that question mark function to work. So just stop using it. If you have written questions to me through there tonight, I will respond to those if I can get to them, okay? But otherwise, feel free to just use the regular chat box below that I know probably has worked a little bit better for many of you. So I welcome to the new people. I also want to welcome back the familiar faces that I see here. We have actually one of the larger webinars I've had in some time. I actually send out an email to my whole list of email people at my Lyme disease information site. So we've got a larger crew. Because of that, I am doubtful I will get through every question tonight. So just be aware of that. If I don't get to your question, that doesn't mean I'm ignoring you. It just means there's a lot of other questions, okay? And then during the webinar tonight, I am creating a recording. As many of you know, I do that every week. And tomorrow morning, usually by 9 to 9:30 in the morning, I try to get that an email sent out to you announcing that the recording is done. Tonight, I have to do a little bit of editing of that recording before I can get it posted up to YouTube. And also some of my edits involve writing a summary of what we talked about so you can more easily try to go through it. I don't put timestamps on it, but at least you get an idea of what we talked about so you can kind of go through the video in a way that you want to find the information that you're looking for. So again, look for that email to come out somewhere around 9 to 9:30 in the morning. When you get that email, feel free to share it with everyone. The more people you send my information to, the more people that get help from the information that we're providing here. All right. So join me. I invite you to join me in my quest to reach as many people as possible, to help as many people as possible with this illness. All right. And so I do apologize. Last week I did get the email out a little bit later, but usually it's between 9 and 9:30. Also, tomorrow morning, when you get that email, you can sign up for next week's webinar. So we have another one next week, and then I'll be taking the week after that off from doing the webinars at least. Okay. All right. So I think that pretty much brings us up to speed here. Let's go ahead and get started with the first question here. So there's a question from Jim. Hello, Jim. Let's see. Hi, Dr. Ross. Thanks for these great webinars. Last week, you said it sounded like my problem with pain when urinating was a candida issue. I've been taking diflucan and nystatin the last 6 days, and things have improved. Good. I'm glad to hear that. But there's still some pain. You suggested 30 days with each med. At what point in treatment, 2 weeks, 3 weeks, 4 weeks, is it reasonable to hope that the pain will go away entirely? Also, is it okay to mix in natural anti-candida supplements like caprylic acid? If so, do any of the natural supplements work better than others when combined with diflucan and nystatin? All right. So everyone, so Jim, first of all, I'm very glad to hear you're doing better. Jim's question last week, just to summarize it, everyone, is that he was having some bladder symptoms of burning on urination. I believe some urinary frequency and urge to pee too. I remember it that way. And his testing with urine testing at the doctors had all come back negative for bacteria infection. And what I told Jim to consider is that it could be a yeast infection in the urethra, which is the tube that runs from the bladder out to the outside. And that often can give you symptoms that look like a bladder infection, even when you don't have urine that shows that it's a bacteria. Often yeast infections that are in the urethra, or even in the bladder, do not show up even in urine testing. So Jim's responding to that. I suggested the way I usually like to treat those is to do diflucan, 200 milligrams 1 time a day, along with nystatin, 2 pills twice a day. So Jim, when I treat for intestinal yeast or bladder yeast, either one, using that combination of nystatin and diflucan, I find it's effective about 90% of the time. And that usually, I usually will treat people for a month. It's usually by 2 to 3 weeks in to the treatment that you start getting major improvements. And it could take the full 3 to 4 weeks for the pain to go away, but it should be gradually getting better throughout that time period. Okay. All right. That's generally what I see. Now, the reason I include nystatin with diflucan is actually your bazooka. It's the stronger anti-yeast medication. But yeast have an ability to become resistant to diflucan. So I usually want to include something else with it, like a nystatin. Okay. Alternatively, you could, instead of using nystatin with your diflucan, you could also use herbal anti-yeast medication. So I will use a diflucan with nystatin, or I might use diflucan with a product I have at my supplement store called Capri Plus, which is a product by Karuna. That's Karuna. Capri, excuse me, everyone, had a cookie right before I got on here. So I'm tasting it there a little bit. Anyhow, Capri Plus has in it a caprylic acid that you mentioned, garlic, and also some oregano oil. And you can combine that with the diflucan. So I usually have people take diflucan. Instead of using nystatin with the diflucan, you could do that Capri Plus, which is 2 pills twice a day. The other herbal option I use is a product called Phytostan by Integrative Therapeutics. That also has the caprylic acid in it, but it also has undulacinic acid and has rosemary and thyme oil in it as well, too, along with some powder coat. And that one you can combine with diflucan too. That's 2 pills twice a day. Now, can you combine those with nystatin and diflucan? Yeah, you can. I think it may be a little bit of an overkill. I usually think you either need diflucan with nystatin or diflucan with Phytostan or diflucan with Capri Plus. But there is no harm in doing a diflucan nystatin with a Phytostan or with a Capri Plus. I don't think I would do both herbal options in that. But again, I think it's overkill. I don't think you need anything in addition to what you're currently doing there. And that's my opinion, okay? This obviously is something, since you've got somebody that's prescribed this for you, you may even want to talk that over with your prescriber as well, too, okay? Let's see. Yeah, I think I've answered your question there. Good, Jim, I'm glad you're doing better. Good luck to you. Hello, Suzanne. Let's see here. With TLabs, if you get an indeterminate result, how would you interpret this reading? Galaxy Labs. So everyone, TLabs is a laboratory that's starting to do microscope exams of either tissue samples or blood samples to see if they can see Bartonella. That's one of the germs they're looking at. One of the people behind TLabs is a physician named Dr. Robert Mozignani. Mozignani is also the medical director for Galaxy Labs. Galaxy is a lab that is independent from TLabs. They're 2 separate entities, but Galaxy is a laboratory that specializes in doing PCR, which is a way of looking at DNA of Bartonella to see if it's in your body. I don't know. Without seeing how this report is actually written, I'm wondering, I can't say for sure because I'm not looking at the paper in front of me, is if what they may be saying is, since you have an indeterminate TLab, which means the microscope exam, that you might want to have a Galaxy Labs enhanced PCR testing. Maybe that's what it means. I can't say for sure because I can't see the paper in front of me. I haven't seen that kind of a finding before. So Galaxy, everyone, runs one type of a way of looking at to see if you have Bartonella in you. It's something called an enhanced PCR. So when you're looking to see if you have DNA of a germ in you, you basically draw your blood, pull the blood out, and you're looking for DNA particles in there. The problem with Bartonella is that Bartonella doesn't readily live in the blood. Bartonella tends to live more inside of cells. So when you do a blood sample, it may be hard to see it. And maybe you get one piece of DNA there, for instance, or maybe you get none at all. What they do with their enhanced process is they're able to grow that DNA and try to get more multiple copies of it to see if it's there, basically, all right? The one problem we have with Galaxy, although Galaxy can detect the 15 different kinds of Bartonella that can infect a human, they actually have the ability to see that with their enhanced DNA PCR test, which is good, okay? The trouble is we don't know how sensitive the test is at finding it. What I mean by sensitive is when we look at testing and we describe how accurate a test is, one of the things we look at is how good is it at finding it if it's there. That's called sensitivity, okay? And again, as I already said, the problem with trying to draw blood to see if Bartonella DNA is there, or even if the Bartonella germs are there, like in a TLab, is that Bartonella doesn't easily live there. It's usually not living right where your needle is when you put it in. No one's ever done studies to tell us how good is Galaxy at picking it up, or how good is TLabs at picking it up. Because again, they have to be swimming right by that needle when you draw it, okay? So that's the only problem with the Galaxy is we don't know how sensitive they are. The lab I tend to like to use to test for Bartonella is to see if you have an immune reaction against Bartonella. And to do that, I'm using IGenex, actually. IGenex has a test called an immunoblot. And what they're looking for with the immunoblot is they're looking to see, has your immune system reacted against the germ? Okay, now, the immune system reacting is not dependent on one germ going by your needle when you put it in, all right? Because the immune system reaction was we're looking to see as your immune system made antibodies that attach to a germ is going to be happening whether there is a germ swimming by your needle or not. All right, so what IGenex has done some analysis of their immunoblot, and their immunoblot has the ability to determine if you have antibodies against the genus, which means the family of Bartonella, which includes the 15 strains, okay? In addition, they could determine if it's one of 4 specific kinds. So if you get back an IGenex test and it says the genus is positive, but the 4 specific strains they can test for are negative, it means you got one of the other 11, basically, okay? That test, the IGenex method, based on their own validation studies where they've gone and seen how good is their test at picking up, their validation studies suggest that it can find it about 90% of the time, okay? I suspect that the Galaxy PCR method is much less at that. In other words, I think Galaxy misses a heck of a lot of stuff. And so my preferred way of testing is to do that IGenex method, basically, okay? All right. So that's the IGenex immunoblot is what the test goes by. Prior to their developing this immunoblot the last maybe 6 months, maybe a year ago, they were doing a test called a Western blot, which is kind of the forerunner for this, but the immunoblot seems to be the better test, okay? All right. Thanks for the question. Good luck to you. All right, let's see here. I'm just flipping over to the Q&A area on my screen. Bear with me. I've got some duplicate questions here. I'm just getting rid of them. Okay, this next question is from Lydia. Hi, Lydia. Let's see. Do you see a problem with storing doxycycline hyclate capsules in the fridge if one is traveling outside the U.S. to a very hot and humid climate? It says on the label to store at room temperature, not refrigerate, but the place I'm going to has room temperatures that are super hot and humid. I have several months worth of Doxy. Doesn't refrigeration extend the shelf life of the Doxy capsules, or will the cold damage it? Why the 1-year expiry date? Okay. So first of all, in terms of expiration dates on any medicines, and that's just not on antibiotics. I mean, you see it on cholesterol medicines, you see it on high blood pressure medicines. There's no magic to it. It's just a random number that the manufacturers decided they were going to stick on every one of their drugs. A number of years ago, the United States military, recognizing that it was losing a lot of medications that had quote unquote expired, went ahead and studied various antibiotics and other medications to see at the 1 year or beyond mark, were the ingredients that were supposed to be in there still active and effective. And they found that medications keep working even beyond the expiration date. Okay, so that expiration date is a random thing. So could your antibiotics work beyond a year? Probably. Do I know for sure? No, but most likely they probably can. In terms of your question about can you refrigerate doxy, can you not refrigerate it, all those kinds of things, I don't know that off the top of my head, to be honest with you. What I would do is talk to your pharmacist. They're the experts in these kind of things. That's their expertise, is knowing what to do with drugs and how drugs behave and how drugs hold in different environments. I would ask to talk to your pharmacist and see what they have to say. Okay? All right. Good luck to you, Lydia. Hello, Mary. Let's see. I have had long COVID along with my Lyme since December 27th of 20. December 27th. I think you mean of 2021 because it's 2022 right now. I don't think we're at December 22 yet. But so anyhow, I think what you mean is December 27th of 21. I have tried the supplement you recommend and also others. I just read about lactoferrin and bovine immunoglobulin IgG. You know, Mary, I don't know whether the lactoferrin or the immunoglobulin IgG will work. I haven't read anything about those, nor have I had the opportunity to try those with my patients. So I'm sorry, I'm not going to be able to give you some input on that one. I'm sorry to hear you're having a hard time with the COVID, and I wish you well with that. All right. Hello, James. Let's see. Hi, I've had Lyme for 9 years. Since getting my COVID vaccine, my Lyme symptoms are worse and now have liver and kidney pain with climbing ALT, AST, alkaline phosphatase, and creatinine levels. What meds and supplements will attack Lyme without stressing liver and kidneys? Thanks. Boy, that's James. That's a big question, and I would have a number of questions for you to even answer that. I would want to know, how long has it been since you had the vaccine? What else have you been on that might be triggering the ALT and AST to go up and your creatinine levels to go up? The difficulty is that there's many different prescriptions, and different ones have different effects on kidney and liver, but together they may all affect kidney and liver. So it's too complicated for me to answer in this kind of environment. I need to know a lot more about you. I would recommend talking to your physician. They should be able to help you figure that one out. Okay? All right. Good luck to you. Hello, Thomas. Let's see. I can't afford a Lyme litter. Doctor, is there anything I can do to start a poor man's protocol? Despite being CDC Western blot positive for Babs, Barton, Borrelia, I could only get 12 days of doxy, which of course only blew away my gut. Now make me worse. Thanks. So Thomas, you may want to take a look at I have published a Lyme disease treatment protocol, of which within that protocol are both prescription and herbal antibiotic recommendations or herbal antimicrobials. That protocol addresses a number of things that should be addressed when you have Lyme. It addresses sleep. It addresses lowering inflammation chemicals called cytokines. It addresses balancing out your hormonal systems. It also talks about diet, but within it, it gives you herbal recommendations for Bartonella, Babesia, as well as Lyme as well too. Let me show you that. And I'll just walk you through it real quickly here. So I'm going to do a screen share here, everyone. All right. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. This is my Lyme protocol. I call it the Ross Lyme Support Protocol. All right. And within it, I mean, read through this. It gives you an idea of what to do. You can even download a version of this. I have a PDF version of this, okay? But it talks to you about the key things to address, like get sleep, and there's herbal and prescription options for that. Second thing it talks about is eating a healthy diet. I walk you through that. Third thing is lowering inflammation chemicals called cytokines made by your white blood cells. If your white blood cells make too many of these, they can suppress your immune system, but also it's those excess cytokines that give you most of your Lyme symptoms. And what I like using for that is curcumin. I talk about that there. I like to have people on an herb to help their body deal with stress, and that's ashwagandha. I like trying to balance out hormones if there is a hormonal problem, and I tell you how to do that there. I like having people on a multivitamin. I talk about it there. And then some basic detoxification steps. I talk about it here. And then finally down here in section 11 is the herbs I recommend to treat Lyme, which is otoba bark, cat's claw, and then liposomal cinnamon, clove, and oregano. Okay. In terms of Bartonella, the herbal option would be Hutania, sida, acuta, and the cinnamon, clove, oregano combination. And then in terms of Babesia, the herbal option would be Cryptolepis along with artemisinin, or just Cryptolepis by itself. Anyhow, so take a look at this. I mean, these herbs all have a cost with them as well, too. But it's going to be less expensive than the doctor visit charges and everything, too. If you're then looking for a source of where you can get your cat's claw or your otoba bark, you could take a look here. I'm working these days with a vendor called Montana Pharmacy. And Montana Pharmacy has a whole line of herbal antibiotics that are found as part of my protocol, but also as part of something called the Cowden protocol. And so, for instance, here's cat's claw that they have. And a basically 2-ounce bottle of this would be enough to last 1 month in your treatment, and it's $25. So this is a bit more affordable than some of the prescription options would be too. Okay. All right. So anyhow, those are some resources for you to take a look at, and good luck to you. So Thomas, the other thing you might want to do is, look through that protocol. That protocol also then links you to other articles that I have on that information site. But the purpose of why I wrote that whole protocol and why I wrote that information site is to give people resources to manage themselves if they need to. All right. It's always best if you can talk it over with your doctor, but I realize that not everyone has that as an option. Okay. All right. Good luck to you. Hello, Julia. Hi, Dr. Ross. I'm currently taking Hutania, biocidin, and cinnamon, clove, and oregano pills to treat Bartonella and Lyme. Do you have any suggestions on how I can encourage my doctor to add sida acuta? My doctor doesn't use it for Bart, but you said it works better if used concurrently with Hutania. Thank you. Julia, I don't know how to convince anyone to do anything. You might want to print off my protocol. Actually, take a look at, I have an article called Kills Bartonella, a brief guide. In there, you could print that off. You could do a right click and print the article and bring it to them. Say, this is what Dr. Ross recommends, all right? The other source of information that you could show them would be to look at writings of Buhner, as in Buhner herbs. And Buhner has a whole book on how do you treat Bartonella and mycoplasma. And the sida acuta is recommended as part of his protocol too. Let me see here. Yeah, it's this book. So by Stephen Buhner. And within here, his protocol, one of the key components is working with the sida acuta. All right. So, I can't make another doctor do anything, but those are Buhner's recommendations is what I find works too. And sometimes just showing them paper will be enough to get a doctor to help work with you on that. All right. Good luck to you. Hello, Amy. Let's see. Hi, my 11-year-old son had acute onset on January 25th of OCD, food restrictions, panic attacks, separation anxiety, school refusal, basically textbook PANS case. We have done the Vibrant Wellness Labs and is positive for Lyme. What are your thoughts on IVIG for Lyme? First of all, if this is PANS also has as a cause strep. So I hope that your doctors have done testing to figure out if your son might also have strep as a cause. The other thing you should be aware of is not only can Lyme be a possible cause of PANS, but also Bartonella can. Vibrant Labs is the new kid on the block, and all the naturopaths have bought the bill of goods from Vibrant, and all of them are running out and doing their Vibrant tests. But Vibrant has some problems. Vibrant has done a good job of validating the accuracy of their Lyme testing, and I think their Lyme test is valid. I think they've shown that it is an effective test, that it can find Lyme when it's there, and it doesn't overly find it either. However, many of they have not done the same kind of work validating their Bartonella, Babesia, and co-infection testing. And it's not clear to me how valid their testing is when it's negative or when it's positive. I think they overfind it as well, too. If your doctors have not looked to see if there could be Bartonella, they may want to do IGenex Bartonella testing, that Bartonella immunoblot that I mentioned earlier, which is probably your better screening test. Is something that you might want to discuss with your physicians about. In terms of IVIG, with Lyme, you ultimately got to get the infection out. IVIG is something that has been shown to be effective in both strep PANS, and in some people that have Lyme giving the PANS, it can be effective. Not with everyone, though. And if you have infection that's under this, you need to kill the infection too. The IVIG is mainly, that's basically giving you intravenous immunoglobulins or antibodies that basically are a way of working through the immune system to try to get at the germs. But when it comes to Lyme, you usually need to do more than that. You usually have to do some germ killing along the way too. All right. That would be my thoughts. All right. So I would, if you haven't done it yet, I would broaden looking for infections, of which Bartonella would be one to take a look at too. Okay. All right. Good luck to you, Amy. Hello, Mary. Let's see. I've tried just about every vitamin, herb, and supplement that is supposed to help with COVID on top of chronic Lyme, but nothing has helped. It was, I was struck twice in a very short period of time, first on November 7th, then again on December 27th, which put me over the edge towards being a long hauler. My question is this: have you heard much about taking, oh, you just asked me about that. No, I haven't, unfortunately. And, that whole area of what to do with long COVID, we still really don't know what to do with it, unfortunately. What I have been finding in my practice is that for most people, I try to manage the symptoms of that are associated with post-COVID or long haul COVID. So if, for instance, we see a lot of people have POTS as part of that, and so there are some treatments you do to either slow down the heart rate or to increase blood pressure that can help with the POTS side of things. A lot of people also have some mast cell activation with that, which means overactive allergy system. There are some things you can do to stabilize that if it's part of it. The other things I like to do in my long haul COVID patients is get them on something to lower inflammation cytokines that I think get revved up and don't turn off. And so I like people on curcumin as well as glutathione. I think from your previous question, that's probably what you're doing. The other thing I'd like to do with my long haul COVID people is to get support to help their energy factories called mitochondria to work better. And so that involves using liposomal glutathione, a product called Trifortify Orange or Trifortify Watermelon by Research Nutritionals. It's a type of glutathione that's really well absorbed. Glutathione can repair damage throughout the body in any cell, but in particular, it's also useful to help repair damage to your cell energy factories called mitochondria from the inside. The other thing that I have people do is start to repair the covering of their mitochondria from the outside, and that is to use a product called ATP 360 by Research Nutritionals. It's made up of the phospholipid fats that make up the covering of your cell energy factories called mitochondria. It can repair them, and usually within a couple months of using it, you're going to know if you're getting benefit. And so they would, it's using it 3 pills 1 time a day. Okay. I also, as part of my long haul COVID, try to get people on adrenal support, thyroid support, and for that I like using ashwagandha. It's a 400 milligram pill. 2 pills in the morning and 2 pills in the afternoon. Okay, so my program for people that get stuck with long COVID is more supportive while we wait for whatever this is to get better. Okay, and so I have benefit doing things to address POTS if they have it. I have found benefit looking for and then doing things to fix mast cell activation syndrome if they have it. In addition, I try to do things to make sure they're getting sleep. I do things to make sure I'm supporting their adrenal and thyroid. And then I find it helpful to do mitochondria repair and support. Okay, let me show you some articles to take a look at here. All right, so in terms of mast cell activation, if you're wondering what that is, take a look here. On my online Lyme guide, take a look under the immune system and take a look at this article called Mast Cell Activation. Okay. In terms of POTS, take a look at this article called Treat POTS and Lyme Disease. Okay. And then in terms of how to support mitochondria, let's see, you can take a look at that. You'll find it, find that in my energy and fatigue section. And that's this article here about what to do to fix your mitochondria and get them working better. Okay. Good luck to you, Mary. Hello, Justin. Let's see. Why is testing so controversial? My roommate in vet school years ago would just culture it from skin, fibroblasts, and then genome it. I was not prepared for the conspiracy of testing and treatment, just ranting. Boy, Justin, it's what a political illness this is. If you're looking for a good overview of why we got to this point, that we have warring camps of physicians and patients are being denied care and all of that, the book that does a good job of looking at it is a book by Pamela Weintraub. It's her last name is Weintraub, Pamela, not Pamela, but Pamela Weintraub. And her book is called Cure Unknown. It's probably over 10 years ago she wrote that book now, but the politics that she lays out there and the why we have this warfare going on like we do, it's the same then as it is now. And so I think it's an accurate book if you're looking for an overview on that. Okay? All right. Good luck to you. Hello, Brandy. Let's see. Do castor oil packs work, and how do you administer and for the duration? So, people use castor oil packs, which involves literally taking, I'm not going to give you the actual procedure, but essentially what it involves doing is you literally take a towel soaked in castor oil, put it on your stomach against your skin, and then you put probably some plastic over that, and then a hot water bottle or some source of heat on top of that. And the idea about that is the castor oil then is supposed to help absorb oils and fat-based toxins from your bloodstream through the skin. and it gets in that towel. So castor oil packs can be a way of helping to remove fat-based toxins from the body. All right. So even like mold toxins are fat-based, for instance, right? But in general, I just don't find it that effective. So I know the theory behind it, but I don't find it that effective. So no, I don't think they work. So I'll leave it at that. Okay. All right. Good luck to you, Brandy. Hello, Bradley. Let's see. Other than bowel tolerance, how much is too much magnesium? What is recommended? Thanks. You know, I'll be honest with you, Bradley. I don't have a top number for you. So magnesium, the reason we all say bowel tolerance is if you start taking enough magnesium attracts water into the intestines, and then that can loosen up your stools, and people get loose stools. All right. So some ways that we tell people to use it is just don't take so much that you're getting diarrhea. In theory, if you start getting too much magnesium, it's going to make you really sleepy. It may give you muscle weakness. It could even cause heart arrhythmias. I just don't know the number off the top of my head as to which would lead to that. Okay. All right. Thanks for that question, Bradley. All right. Let's see here. Oh, I'm flipping around. I have this Q&A area on my screen and a chat area where you can write questions either way. And I'm seeing some of you have written questions in both places. So bear with me as I'm trying to go through some of that. Okay. Hello, Julia. Let's see. Do you think combining Alinia, clarithromycin, cryptolepis is an okay treatment for Babesia? Can't do quinine or artemisinin, and Mepron is really expensive. Trying to start somewhere, thank you. So I think clarithromycin, cryptolepis could be effective. I don't really think Alinia works. I have been solidly disappointed with it. I know it's an antiparasitic, but in general, it's not what I would recommend to include in a Babesia treatment. I have recently republished my Babesia treatment guide. You may want to take a look at that. And it includes not only the cryptolepis option, it includes options of using artemisinin. It includes options of using something called cryptolepis sida acuta alcornea solution. Those are some herbal options for you. It also looks at using a group of medicines called the quinolones, or quinolines, I should say, quinolines, and those would include things like primaquine and a newer drug called tefenaquine. So there's many other options that you have here, but I don't find benefit out of doing Alinia. All right. Good luck to you, Julia. Oh, let me show you that article here real quick. So take a look in my infection treatment plan section here. And where is it here? Oh, here it is. So I just updated this around a month ago. So take a look here. I talk about the different combinations you can use. There's the atovaquone-based treatments that have malorone and Mepron in them. And then here is that section on what I call the quinoline-based treatments with primaquine and tefenaquine. And then here's some options in terms of cryptolepis, artemisinin, or this CSA treatment as well too. Okay. There you go. Good luck to you, Julie. Hi, hello, Mary. Let's see. Hi, Dr. Ross. I have your anti-germ action plan book, and it has been very helpful. The book addresses each infection separately, but how would you treat patient with Lyme, Bartonella, and Babesia together? Thank you. That's where it gets tricky. First of all, I'm glad you found it helpful. I'm actually in the process of rewriting that book, and probably have come up with a new title for it as well too. I'm hoping to have it republished in about another month or two. I'm self-publishing, and I've got to get a draft of it over to my editor, and I've got some other work to do around it. But anyhow, what you may want to do, Mary, for each of the infections is take a look at my online site that I was just showing people. The treatments for Lyme, Bartonella, and Babesia that I have on the online version of information that I give out are a little bit more present day than the anti-action plan book that you're looking at right now. Okay, this doesn't mean those plans won't work that I have in there, but I've done some updates and they're a little bit, and so take a look at what I've written online about that. Okay, now in terms of the different germs, so this is where it gets complicated. You need a physician that can help understand the various interactions of different medications. All right, and so I would hope you're actually working with somebody on that. When I have somebody that has Lyme, Bartonella, and Babesia together, usually what I'm going to do is to go after Lyme and Bartonella together first. And in about 2 or 3 months, as we start getting some of those Bartonella symptoms under control, then I may add in a Babesia treatment. The reason that I choose to do it in that order is based on the observations of Burrascano. Burrascano was a physician from Long Island that was kind of one of the Lyme pioneers in this country. He pioneered treatment for Lyme and educated a lot of us too. His observation and his practice is that if he tried to go after Babesia before getting Bartonella under control, it made it more difficult to get Bartonella out. Okay, all right. So having said that, there are ways you can work with antibiotics that will treat both Lyme and Bartonella at the same time. All right, and one way to do that is to choose as one of your antibiotics rifampin. Rifampin is very good against treating Bartonella. It also can pick up the cyst form of the Lyme germ, because remember, Lyme has spirochete and Lyme has a microscopic cyst form of the germ. Okay, rifampin can pick up the cyst form. All right. And then the other thing you might want to combine that with is either clarithromycin, which is Biaxin, or doxycycline. That doxy or clarithromycin coupled with rifampin is a good Bartonella treatment. It's also the doxycycline or azithromycin would treat the spirochete form of Lyme. Okay. And then finally, after you're on that for about a month, I would add in what I would do with my patients is I add in a combination product called liposomal cinnamon, clove, oregano. And the reason I do that, it's 1 pill twice a day, is that I'm trying to pick up what are known as persister or hibernating forms of Lyme and Bartonella. The azithromycin rifampin or clarithromycin rifampin or doxycycline rifampin only hits growing. It doesn't do anything for persisters. Liposomal cinnamon, clove, oregano picks up your persisters. Okay. Now, once you start getting through some of your Bartonella symptoms and you seem to be improving at about 2 or 3 months, then you might want to add something that will go after Babesia. But where I would start first is by just going after 2 infections initially. Okay. That's what I do in my practice, at least. All right. But clearly, you should talk that over with your physician as well, too. Okay. All right. Good luck to you, Mary. Hello, Flickerine. Let's see. Hello there, and thank you. What is your opinion on Armin Labs testing? My son had positive results for Ehrlichia, Babesia, and Bartonella, but not Lyme. So Armin Labs, the main test technique that they use is a technique called an elispot. And elispot is basically an immune reaction test. And what it's looking at is they draw your blood, and they pull out a type of cell from your blood called T white blood cells. T white blood cells are the kind of cells that attack a germ. Okay. And then they take your T white blood cells, and in a test tube full of those T white blood cells, they add in proteins from different germs like Lyme, like Bartonella, like Babesia. And then they see, do those T white blood cells make and manufacture a group of cytokines, and they measure the cytokines, okay? So it's a T cell reaction test, and your T cells will react by making cytokines if they have seen these infections, all right? So that's the theory behind it. The problem with Armin Labs is Armin is using a test kit that's actually manufactured by a different company. Armin doesn't manufacture its elispot test kit. And neither Armin or the company that manufactures their test kit has done validation studies to prove how accurate it is. Now, having said that, when we look at elispot testing and its accuracy, generally for any kind of infection, they seem to be about 85% successful at finding the right infection when it's there, okay? That means that they miss it 15% of the time. It may also mean that they overdiagnose 15% of the time as well, too, all right? So just keep that in mind. It's not a perfect test. The better immune reaction test to do is actually IGenex Labs. And IGenex is their main test these days for Lyme and for Bartonella. It's something called an immunoblot. That's measuring if you make antibodies against these various germs. And what makes it even better is the immunoblot for Lyme looks to see from IGenex if you're making antibodies against one of 8 strains of Lyme germ. The Armin Labs elispot, I think, is only looking to see if you have antibodies against 2 or 3 different strains. So it's not as many, okay, for the Lyme germ. For Bartonella, the elispot of Armin only looks to see if you have a reaction against Bartonella henselae. But we think there are 14 other kinds of Bartonella that can cause you problems. And IGenex method, immunoblot method, has the ability to see if you have antibodies against the whole family of 15. So that's what makes it better. When it comes to Babesia, to be honest with you, even the techniques, which are antibody techniques that that IGenex uses, IGenex also does a microscope exam called a fish test. Those methods will miss Babesia if you have it. And I think with either one of those tests, if it doesn't show up, it doesn't exclude that you don't have Babesia. In my opinion, the best way to figure out if you have Babesia is to look and see if you have a lot of symptoms of Babesia. Okay, so symptoms of Babesia, and I'll show you an article you can look at here in a minute. Symptoms of Babesia include night sweats, pretty heavy night sweats actually, anxiety or panic attacks, skipping or racing of the heart, getting lightheaded easily on standing, a sense of not being able to get enough air, that's called air hunger, sometimes having a lot of frontal headaches or migraine headaches. If you have a large number of those kinds of symptoms, that can be suggestive of having Babesia from a clinical standpoint as well, too. Okay, all right. Let me just do a quick screen share here for you. So if you're wondering what Babesia symptoms are or what Bartonella symptoms are, how do you tease out what those are? Take a look at my section over here called How to Diagnose. And if you want to see a list of what I call Bartonella specific symptoms, take a look at this article. If you want to see a list of Babesia symptoms that I would suggest, take a look at this article called How to Diagnose. Okay. Good luck to you. Good luck to your son. Hello, Charles. Hi, Dr. Ross. My naturopathic Lyme mold doc is recommending D-ribose for energy and combating fatigue. Is this helpful or the best thing to use? So, yeah, it's so D-ribose let me stand back. So when somebody has low energy in Lyme disease or mold toxicity or co-infections, there's a number of factors. Number one, can be poor sleep. So make sure you're doing things to get sleep. Okay. Number two, can be that that your immune system reacted to these germs is over manufacturing cytokines, and those cytokines themselves give fatigue. Okay. As a side effect of cytokines. In addition, those cytokines interfere with how your body's hormonal systems work as well, to your adrenal and thyroid. So also, as part of dealing with fatigue, I like people to get sleep. I like to do things to lower cytokines. That usually involves working with liposomal curcumin. The product I like for that is a product made by Thorne called Bariva 500. It's 1 pill 3 times a day. That lowers your cytokines. I like to support the adrenals and thyroid with ashwagandha. That is an Ayurvedic Chinese medicine herb. You do 2 pills in the morning of a 400 milligram pill and 2 pills between 1 and 2. Okay. Now, in addition, if people are still having low energy, then the next thing I'm going to do is I want to do things to support and repair mitochondria function. So mitochondria are the energy factories found in every one of our cells. And by some estimates, there are 300 to 400 mitochondria in a cell. Inside mitochondria, sugar and fat are burned through a bunch of chemical reactions to create cell fuel, which is something called ATP. Okay. Now, when you have chronic infection and you have mold toxicity, one of the things that happens is the immune system, in reacting to these infections and mold toxins, manufactures a bunch of oxidizing agents. And the job of oxidizing agents is to try to damage the toxins and damage the germs, but they damage the covering of your mitochondria. And if your mitochondria covering gets damaged, you don't get adequate intake of sugar and fat to the inside to be burned into chemical reactions. In addition, that healthy covering is involved in transferring electrons for a bunch of chemical reactions, and it can't do it well if it's damaged. Okay. All right. So what can you do to support mitochondria? Well, one thing is this D-ribose. D-ribose is a sugar source that can be used by mitochondria to create cell fuel. Okay. So some doctors try that. One big proponent of D-ribose is a physician named Jacob Teitelbaum, who's big in the chronic fatigue fibromyalgia world. He's been a big proponent of D-ribose for years. I trained with him and started using a lot of it in my practice when my practice predominantly was a chronic fatigue syndrome fibromyalgia practice. I'll be honest, I used a lot of the stuff. I just don't find it that helpful. I'm not saying it won't work. I just don't find it that helpful. What I have found more helpful, and these are some ideas you might want to talk with your physician about, and you could even do this in addition to the D-ribose, but what I have found most helpful is 2 things. Number one, you want to take glutathione. Glutathione is a reparative antioxidant that can start fixing the damage created by all these oxidizing agents from the inside of the mitochondria. Your mitochondria don't make a lot of glutathione on their own, so they're already deficient in it. And if they're trying to fix themselves, they will exhaust their glutathione supply. So you want to put more in, okay? And so for that, I like using the liposomal glutathione product by Research Nutritionals. It's a product called Trifortify. And people take 1 teaspoon 1 time a day, okay? Second thing I like to do is fix that covering, all right? And that's to use a product by Research Nutritionals also called ATP 360. And you would do 3 pills 1 time a day. The main component of that ATP 360 is all these phospholipid fats that make up your mitochondria covering, all right? They've got good science showing it works, that actually results in better energy, may even help heal some of your nerve cell membranes, to be honest with you as well too, okay? All right. Now, the one thing that you should be aware of with ATP 360 are 2 things. Number one, Research Nutritionals made an older product called ATP Fuel. And that also can fix the covering, but the mix of fats in it is not as effective as the mix of fats in the ATP 360. So the 360 is a newer and better product. So get the ATP 360, not the ATP Fuel, okay? Now, people still use ATP Fuel because they found benefit from it. And if you were to do that, that would be 5 pills twice a day versus the ATP 360 is 3 pills 1 time a day. Okay. Now, if you are taking Mepron, Malarone, or atovaquone to treat your Babesia, if you have Babesia, you do not want to take something that has coenzyme Q10 in it. Both ATP 360 and ATP Fuel, in addition to these phospholipid fats, have a number of micronutrients in the products to help your mitochondria work better. And one of those micronutrients is coenzyme Q10. All right. So you don't want to mix that with your atovaquone-based or Malarone or Mepron-based Babesia treatment. If that's the case, Then what you want to do is another product by Research Nutritionals, which is called NT Factor. And NT Factor has no CoQ10 in it at all. And the way you would do that is 2 pills 3 times a day to rebuild that phospholipid covering. Okay. All right. So I just said a lot of stuff. I can do a screen share and show you a couple things to take a look at here. All right. And as I said, if you want to do what I just recommended, in addition to the D-ribose, you can. It's just my own experience. I just have never really found it to be that effective of a product. Okay. Or a supplement that helps. So take a look at this energy and fatigue chapter again. Again, here's where I talk about what to use for mitochondria repair. All right. And then in terms of a comparison of these 3 products, I've written an article called A Comparison of ATP Fuel, ATP 360, and NT Factor Energy, where I kind of tell you in which situations would you want to use one of these. Okay. All right. So take a look at that article there as well, too. All right. Good luck to you, Charles. Thanks for that question. Hello, Michael. Let's see. Thank you for sharing your knowledge with us. You're welcome. Maybe you can shed some light on a mystery. I have severe chronic Bartonellosis, babesiosis, borreliosis, as well as a mast cell activation syndrome. What could cause frequent daily swelling of the upper eyelids and sometimes general swelling of the face? It comes with a concussion-like headache. It feels like my brain is swelling in my skull. Also, sinus is very heavy and swollen. It is triggered by foods or chemicals, but when I review symptoms for histamine intolerance or MCAS, they never mention this kind of swelling. I don't have the typical MCAS or histamine symptoms such as itchy skin, runny nose, nor any notable GI symptoms. Are there atypical MCAS presentations? What could cause this? In all the extensive reading I've done about tick-borne diseases, I've never seen any mention of swelling in the upper eyelids. Sometimes the swelling is pronounced as they balloon out over my eyes. Have any insights? What could be done? All right. So everyone, MCAS or mast cell activation syndrome basically means that a type of cell in your body is overly turned on called a mast cell. All right. So mast cells, historically, we think of as being the allergy cell. It's if pollens or cat dander, dog dander, whatever lands on a mast cell, it will release histamines, and those histamines then cause your blood vessels in your nose to leak clear fluid. You get a runny nose, okay? They also will cause you to get itchy in your skin. You might get puffy or swollen in the areas where you're having your allergic reaction because the histamines can do that too, right? Now, these mast cells, we now know, actually can get turned on, not just by things we're allergic to, but they can get turned on by mold toxins. They can get turned on by infections like yeast in your intestines or Lyme or Bartonella, and they can get overly revved up, okay? And they kind of become overly turned on. So then if you do get exposed to chemicals in your eyes, or you get exposed to stuff in your nose, you may have a strong histamine reaction up here because they're already ginned up too much, and you could get some swelling of the eyelids. You might even get swelling of your face too, okay? Now, have I ever seen something like that happen? No, I mean, to answer your question, but I would wonder, just as you've written here, and I suspect your other doctors are wondering too, if this is some type of a variant of mast cell activation. I'm not aware of what else would do something like this, okay? So I would keep talking with your doctors about that, but I would wonder about that, okay? And so I hope that in terms of helping to stabilize your mast cells, they're looking at doing a number of things. Number one, I like to have people on something that stabilizes the mast cells so they don't release as many histamines, all right? And the 2 herbs I like using for that one is called quercetin. There's another one called luteolin. You can even use both together, all right? The other thing I like to do, especially, let's say if you're getting a lot of stuff up here, you might want to try some antihistamine drops in your eyes. That might help, okay? You can do antihistamines. You can do things like Zyrtec or Claritin. You can do what are known as H2 blockers, which would be stomach acid blockers like Tagamet, cimetidine. Those things can sometimes be helpful as well too. You can get on something called Singulair, which helps decrease the inflammatory effects of all these histamines. Okay, that's a 10 milligram pill 1 time a day. And for GI symptoms, if you have a lot of them, which it doesn't sound like you do, you can take something called Cromolyn, which is a prescription mast cell stabilizer, but it's really going to work just on the mast cell in your gut, not throughout the body, okay, because it just stays there basically. Other things I have people do is to try to get on low histamine foods. And if you are really reacting to a lot of foods, you might want to do something called an elimination diet. Elimination diet is something you can do where you can help determine what are you reacting to. Okay. All right. So let me just I'm going to do a screen share and show everyone resources here to take a look at some of this. All right. So take a look at my immune system chapter here. This is my article on mast cell activation. All right. And I talk about testing isn't the greatest. There are some tests you can do, but one of the big things I should mention too is decrease stress. One of your strongest stimulators of your mast cells is stress. All right. Get rid of things that you're reacting to, including try this elimination diet. Just click here, this article. It'll pull you to my elimination diet article. Get your infections under control, remove your toxins, lower cytokines. Here's the different kind of H2 blockers. H1 would be your antihistamines. H2 would be your stomach antacids. And then do a leukotriene inhibitor, which keeps inflammation down. That would be the Singulair I was just telling you about. And then the herbs would be the quercetin, luteolin. Okay. And then finally, try a low histamine diet. So those are the kind of things you might want to do for that. All right. All right. Good luck to you, Michael. Hello, David. Let's see. Does CBD topical work for joint pain? It can. Doesn't mean it will, but it can. So CBD can help. THC topicals can help as well too. It's all hit or miss though. You just have to give it a try and see. Okay. All right. Good luck. Hello, Amy. Do you recommend probiotics even when there is not obvious bloating? And how about digestive enzymes if no malabsorption? So I do recommend probiotics as part of a person's Lyme disease treatment because whether you're using herbal antibiotics or prescription antibiotics, there's going to be a lot of pressure on the healthy bacteria in your gut. You may eventually alter the good bacteria makeup of your intestines. And if you alter that, it can make it easier to get too many yeast. The other reason I use probiotics is I'm trying to still promote good microbiome. Keep in mind, your good bacteria microbiome in your gut is responsible for sending out neurotransmitters, signals to your immune system to work correctly, keeps yeast from growing too much, helps with food digestion, removes toxins, removes things we're allergic to. That gut microbiome is really important. And when you're on antibiotics, you've got a lot of pressure or injuring that good microbiome. Even if you're not gassy or bloated, I want to do things to support it. Okay. So yeah, I will have people on probiotics. In terms of digestive enzymes, I'm only using those if I have obvious signs of pancreatic insufficiency. The way you would see that is if you're having oil or undigested food particles in the toilet regularly, or if you do a GI map test or a Genova GI diagnostics profile, any one of those, they're going to look at some chemicals made by the pancreas, something called an elastase. And if the elastase on those profiles is low, then it probably means you got pancreatic insufficiency and you want to use digestive enzymes then, okay? But I usually don't use digestive enzymes in my practice unless I've got some chemical reason to do it, meaning that the elastase isn't as high as it should be on the stool test, or if people have just obvious evidence of bad digestion with oil in the toilet and regular amounts of undigested food. Okay. All right. Thanks for the question, Amy. Hello, Joe. Hi, Dr. Ross. I was bit by 3 ticks in 2015 and tested positive for Rocky Mountain spotted fever and then later Lyme disease. The most recent positive test was in 2021. Also in 2021, I was diagnosed with Babesia. I took multiple prescriptions of doxycycline over a period of a number of months. I took a atovaquone and an antibiotic, which I don't remember right now. My last Lyme test and Babesia test were both negative. I still live in constant pain, both neurologic, muscular, and skeletal. Even though my last tests were negative, is it possible my pain symptoms still comes from Lyme, Babesia, or even the Rocky Mountain spotted fever? So the quick answer is yes, but let me kind of round that out a little bit. So first of all, Rocky Mountain spotted fever probably does not become chronic. Usually doxycycline is effective against taking care of that one, okay? But Lyme and Babesia can be chronic and become quite difficult to get rid of. There is no testing that we can do that proves those infections are out of you. As you know, most of the testing that we do for these is looking at antibodies. So the immunoblot, Western blots, even the ELISA testing for Babesia that's done. These are tests that look and see if your immune system is making antibodies. The elispot test that Armin and TLabs do here in the United States is an immune reaction test called a T-cell reaction test. The problem with all those, a negative test doesn't prove the germ is gone. You could have a negative test and the germ is still in you because of immune suppression. Your germs may just be partying on, having a great time, releasing chemicals that make it so that your T cells can't react and make it so that you don't make antibodies. So negative testing doesn't prove that the infections are gone. Likewise, even if you maintain reactions, the germs could still be under control. So testing, once you get a positive test, going back and repeat testing is just not a worthwhile enterprise. It's basically a waste of money, actually. I know a number of my colleagues are doing it, but there is nothing we can glean from a test as to how much germ load is in you. All of those tests do is measure an immune reaction, and that immune reaction has many things that can alter what it does. So again, if your germs are way out of control, they may be suppressing your immune system, all right? So, anyhow, just keep that in mind. Yeah, you could still have symptoms of either Lyme or Babesia. Rocky Mountain spotted fever, I think, would be lower down on my list. Generally, once you've had rounds of doxycycline, that should have taken care of that one. Okay? All right. Good luck to you, Joe. Hello, Kate. Hi, Dr. Ross. A few questions. At what level would you consider treating Candida on an oat test? Mine was 23 and the range goes to 29. I don't think I have Candida symptoms though. 2, I'm recovered from Lyme, but got the booster recently and I've been very disoriented and feverish this whole week. Do you have any advice? So, regarding the effects of, I assume you mean the COVID booster. When you get the COVID vaccine or the booster, it triggers a release by your white blood cells of cytokines, right? And cytokines, as many of you know from listening on these webinars, are what give you most of your Lyme symptoms, what give you most of your mold toxicity symptoms, what give you most of your COVID symptoms, what give you most of your COVID reaction symptoms, all right? So white blood cells, when they see the booster, manufacture cytokines. And those cytokines can give you fever, can give you disorientation, can make you achy, can make you fatigue. Most likely that's what's happening to you here. What I usually suggest for my patients in situations like this is make sure you're doing some strong anti-cytokine work. So you could be on that Thorne Mariva 500, the curcumin product, 500 to 1,000 milligrams 3 times a day. You also would get on some liposomal glutathione. So what the curcumin does is it gets inside your white blood cells and limits their cytokine production, okay? What the glutathione does is it lowers signals that go to your white blood cells telling it to make cytokines. And so you would do liposomal glutathione, and I would do 1 teaspoon once or twice a day for that, okay? Now, the OAT testing is interesting. So OAT, everyone, stands for organic acid test. And I had started, so organic acids are chemicals that are made by bacteria or yeast. And in theory, there's a number of organic acids that yeast can make, like arabinose, for instance, and a few other ones. I had been starting to use those organic acid tests in how I was approaching yeast, but recently I did a big literature search on this. And I have to tell you, there's nothing that, there is no testing that's been done that verifies the accuracy of whether yeast do make arabinose or don't make arabinose, whether yeast do make a number of these other organic acids or not. So I'm not really clear anymore if organic acid testing really gives us useful information. And in fact, I've stopped doing it based on my own literature search on that, unfortunately, okay? For me, when I'm trying to figure out if somebody has yeast, there really is not a good test. What we're interested in is, do you have too many yeast in your intestines relative to what you're supposed to have, okay? So if we do a stool culture and we don't see much yeast, it just means the culture's not picking it up. You may still have more in you than you're supposed to. If you have huge amounts of yeast, but you have no symptoms of your yeast, that may mean your body's doing fine with it, all right? So that's not a good way to do it. There really isn't a useful way. It's more of a clinical suspicion. So for instance, if you've been treated with antibiotics and you suddenly develop a lot of gasiness and bloating, if you've got vaginal itching, vaginal discharge, the other thing that yeast can sometimes do is cause a lot of changes in your skin where you get a lot of pimples and acne, or you get a worsening of eczema type of reactions, or if you start getting a lot of reactivity to all kinds of foods, those are symptoms that suggest too many yeast in your intestines. And I usually will use those more as my indication as to whether somebody has yeast or not, okay? So I was thrilled reading about organic acids. I was thinking, this is it. This is the thing that's going to make for sure I'm going to know people have yeast. But I'm just really disappointed as I started looking at the research on this. It just doesn't support doing it, unfortunately. All right. Thanks for that question. Hello, Susan. Let's see. Warm burning feet. Is that BART? I don't think it's diabetes. I like the way you answer your part of your question there. So burning feet is a symptom of nerve injury or neuropathy. One of the more common things that can give neuropathy is diabetes. So I appreciate you said that. In the world, but in our world, the world of Lyme and tick-borne illnesses and mold toxicity, there's a few other things that can do it. Number one, if you have mold toxicity, sometimes that can do it. Number two, I have found if people have raging yeast in their intestines, that the toxins that get released by the yeast into the bloodstream sometimes give you symptoms of neuropathy as well too. Number three, Lyme can do it. And number four, Bartonella can do it. So in the world of tick-borne illnesses and mold toxicity, figure out where you are with all those too. Okay, so it isn't just a matter of saying that it's Bartonella, unfortunately. Okay, all right. Good luck to you, Susan. Hello, Rich. Hi, Dr. Ross. I am treating for Lyme and Bartonella. I am taking some of the supplements that you recommend for these things. From listening to your webinars and reading some of the info on your website, it seems as if the most important non-prescription germ-killing thing to take for Lyme and Bartonella are Cryptolepis, sida, acuta, Japanese knotweed, Houttenia, cemento banderol, and the doctor-inspired formulation cinnamon, clove, oregano essentials. Would it be better to take all of these supplements each day, or is it better to maybe pick 2 or 3 to take each day and rotate them in and out? Hold on just a minute. Let's see here. I just lost where your question is. Oh, here it is. Would it be better to take all of these supplements each day, or is it better to maybe pick 2 or 3 to take each day and rotate them. It would be hard to take the doses that you recommend of each day. Also, are there any other really important germ killers that you would recommend for Lyme or Bartonella that I did not mention? Thanks for all these amazing webinars. All right. So if I'm going to start, so you don't have to take all of these things, okay, to get over it. You just need to take enough of them. So where I start when I'm trying to treat somebody for Lyme and Bartonella with herbal antibiotics. For the Lyme growing Lyme, I usually like using a combination of the cat's claw and the atoba, okay? For persister form of Lyme, I like to add to that the liposomal cinnamon clove oregano, all right? For Bartonella, I like to use Hutania and sida acuta to go after growing Bartonella. And then for the persister form of Bartonella and biofilm Bartonella, I like using the liposomal cinnamon clove oregano. So I probably would hold off on adding all the other things like the cryptolepis, unless you have Babesia. I don't think you necessarily need to use cryptolepis. I don't also think you necessarily need to use Japanese knotweed. I would probably, what I do with my own patients is I set those aside and I would add those in if we're not making enough progress over the next, maybe 4 to 6 months actually. But initially, I would confine most of my patients when I start them on treatment to taking sida, Hutania, cat's claw atoba, and then the liposomal cinnamon clove oregano. Okay, all right. And I don't rotate them like you're suggesting either. All right. Now, if you're about 4 to 6 months into treatment and your Lyme and or Bartonella symptoms aren't improving, probably then you might consider either adding cryptolepis or adding Japanese knotweed, but you don't need to do both, okay? So just because I mentioned in some of my written materials that these are things you can take, if you notice in my written materials, I say start here and then eventually add if you need to, okay? So anyhow, those will be my comments for you, all right? Good luck to you, Rich. So, Rich, one of the reasons I'm not telling you to take more things is the more things you take, number one, it gets costly, right? Number two, taking more doesn't necessarily mean you're going to get better any quicker. And number three, the more things you take, the more chances of interaction problems you have, okay? So I tend to take a minimal what's going to get you there kind of approach, not throw the whole kitchen at a person at the same time kind of approach, okay? All right. Good luck. Hello, Carter. Let's see. Do you recommend supplementing salt, calcium, and potassium? No, not regularly, unless I've got some medical reason beyond just having Lyme and co-infections. So, for instance, if I've got somebody that has a lot of low blood pressure problems, I might have them start taking salt to expand their blood volume. If I've got somebody that has osteoporosis, I might have them start taking calcium. If I've got somebody on a diuretic for their blood pressure and that causes them to release potassium, I might put them on potassium, all right? But to just uniformly put people on these, I don't do that regularly. All right, thanks for the question, Cart. Oops, okay. Let's see, I've got a person that asked a question twice. Bear with me while I get rid of that. Hello, Lainey. Let's see. I have heard GCMAF has been beneficial for immune reactivation. Do you have an opinion on it? So GC, macrophage activating factor, is a chemical that you can take that will turn on a type of cell called a macrophage. Okay, macrophages are very useful at fighting virus infections, for instance. We used to be able to get this from Europe, but the Food and Drug Administration a couple of years ago started blocking it coming through. Most of us, because of the hostile approach that the Food and Drug Administration was taking to it, no longer use it. I don't recommend it anymore because they've taken a very hostile stand on it, basically. But it used to be something I would use as part of my regimens. If somebody had chronic active viruses, I might use it to turn on the macrophages, so the macrophages will more actively fight viruses. But generally, it's hard to get through without having anyone, without having problems with the FDA these days, unfortunately. All right. Thanks for your question. Hello, Mary Beth. Let's see. Hi, Dr. Ross. I'm a Lyme clinician in New York and follow your work. Well, hello. Welcome here. Thank you for the generosity with which you give information. You're welcome. Question for you. On that paper that was published showing azoles being helpful for stationary forms of Bartonella, do you think all the azoles are equal? Very good question. You know, I was just updating my Bartonella guideline today. I haven't added the words. I'm sorry, my Bartonella article at my Treat Lyme by Marty Ross MD site. And I was updating it as I'm getting ready to also republish those as a book again too. Okay. And I was looking at that azole question. So, so I'm looking at that, but also have over the last 6 months been working with azoles in my practice as part of Bartonella treatment. So let me try to round this out a little bit for everyone that's listening in here too. So everyone, azoles are a family of antimicrobials, and they include things like fluconazole, which is diflucan that we use for yeast, right? And they also include something called clotrimazole, which is a topical anti-yeast medicine that's used for skin infections, also used for women's vaginal yeast infections. And so, Mary Beth, I'm not sure if we're talking about the same article, but I know that Dr. Yingzheng is a researcher out of Johns Hopkins that about a year and a half ago, 2 years, I guess 2019 is when he published the paper. I published a paper towards the end of 2019 that showed that miconazole and clotrimazole, which are two azoles, could be effective at treating Bartonella. And he showed that they were effective at treating both growing Bartonella and persisting Bartonella. Now, the trouble with both of those is that the miconazole and clotrimazole are not available in an oral form. All right, and they're not even manufactured in an oral form. You can get some compounding pharmacies to do clotrimazole, but probably it's not well absorbed. So as a result of that, though, looking back over the last 6 months or so into my Bartonella treatments, I have at times been adding in fluconazole, which is diflucan. And I have had some success in doing that. So I might do like a clarithromycin along with fluconazole as a Bartonella treatment, and I would still use liposomal cinnamon clove oregano with that, for instance. And it seems to be moving people forward. I have also used itraconazole, which is also another azole, and I'm getting favorable results with that. I have not done a comparison, though. And so to answer your question, I'm not sure what the best azole is. So far to date, I have been working with both itraconazole and fluconazole, and I would combine them with the macrolide like clarithromycin, azithromycin. I might combine them with Bactrim. I might even do the macrolide, Bactrim, and the azole together, for instance, okay? I still, for a lot of my treatments, though, I'm still finding good movement, and I think as it's going after the persisters by using the liposomal cinnamon clove oregano. Sometimes I'll throw methylene blue in with that too. But anyhow, the question is, can you use azoles as part of Bartonella treatment? Yes, I have been doing that. And the two that I have been using are fluconazole, itraconazole. I can't make a distinction as to whether one seems to be doing better than not. I can tell you I think they're giving benefit for my patients, though. Okay. All right. Thank you. Thanks for that question, Mary Beth. And I think I know which Mary Beth you are, but I won't use your last name here because you didn't use it. So anyhow, I'm glad you're finding some help from all this too. I'd be interested in knowing what you find by using the azoles as well too. All right. Thanks for the question. So that's from Mary Beth again. Let's see. There's a lot of use of clotrimazole, but the compounded LA is another expense for the patient. I don't know that it's helping clinically. Yeah. So Mary Beth, I never really used the compound. So again, everyone, clotrimazole and miconazole were the two azoles that were researched. The clotrimazole, again, there is a compounding pharmacy out east that has been compounding it. But if you really look at so they're doing it as a liposomal, meaning they're microscopically wrapping it in fat to try to promote absorption. They've never done any studies to show it's absorbed though, right? And if you really look at the science behind clotrimazole, it's just horribly absorbed. And so I'm very doubtful, even in a liposomal variety, that clotrimazole would be absorbed out of the gut, basically. We do know that fluconazole is absorbed. We do know that itraconazole is absorbed. And again, clinically, I'm seeing benefit by using those as part of my Bartonella treatments too. All right. So Mary Beth, probably in about the next day or two, you'll see an update that I'll send out on my Bartonella article. Again, I've rewritten the content of it. I just haven't put it up yet. And I rewrote the content of my Bartonella treatment article because I'm getting ready to have it in my an update of my anti-germ actions plans book that should be coming out in the next, I don't know, maybe 2 or 3 months. I'm self-publishing, so we'll see how quickly I can get to it. So anyhow, if you have signed up, everyone, if you have signed up for my email list at Treat Lyme by Marty Ross MD, as soon as I do publish the updated version of my Bartonella to include using azoles, it also has information about using lumbar kinase to break up fibrin nest. So you will see an update on that. It's probably going to come out tomorrow. I may hold off till Monday. It may not be till Monday, till after the holiday coming up here. So anyhow, but you will get notification through my email list that I have published an updated version of that Bartonella article. Okay. All right. Thanks for your question, Mary Beth. Hello, Denise. Let's see. 15 years ago, I was treated for a year with antibiotics for what seemed to be Lyme, multi-systems, including neuropsychiatric. I seemed to get mostly better except for hearing loss, headaches, and fatigue. Present day, I have been sick for a year with increased headaches, low-grade fever, joint pain, fatigue, brain fog, muscle weakness in the legs, etc. And IGenex was run, and I was surprised to see no active Lyme or co-infections, only a past Bartonella antibody and past tick-borne relapsing fever and high ANA. I am confused and frustrated. Any suggestions for test? Also, could a 21-day run of doxy before the labs interfere with the results? Thank you. So first of all, doxycycline, if you're doing a test that either is doing an elispot test or an antibody test like a Western blot or immunoblot, being on doxycycline actually enhances the ability to get a positive test. And the reason is when you use doxycycline for a few weeks, you kill germs, it releases those dead germ parts into your blood system where your immune system can see them and even have a stronger reaction. Okay, so that wouldn't interfere. Now, if you're on doxycycline or antibiotics before you do a PCR or a DNA test of the germ, where we're measuring how much the germ is living in you, it would alter those, okay? Keep in mind, DNA PCR testing for Lyme will only find it if it's in you 30% of the time, so it's not a good way of testing for Lyme anyhow, okay? All right, now, as I said earlier today, there is really no way of repeat testing to figure out if your germs are active or not. So I know none of my colleagues are doing it. I just don't support it. There's no science that validates that that's an accurate way to look at antibody levels or T-cell reaction to figure out if a germ is living and active in you. It just hasn't been validated, okay? But there's something you should consider here. So when, in my experience, when I get somebody well, about 80% of the time, if they come back, 80 to 90% of the time, if they come back to see me again because they quote unquote have relapsed and they've got all of the symptoms back again of their Lyme, the first thing I want to know, and the first thing I'm going to try to figure out with them, is it possible they have too many yeast in their intestines? Now, I know that may seem kind of far-fetched, but just hear me out on this one, okay? So remember, Lyme disease, the main reason you feel bad in Lyme disease is your immune system overreacts to the infection and makes too many of those inflammatory chemicals called cytokines, right? So cytokines are good and bad. White blood cells make them when they see a mold toxin or they see Lyme to turn the immune system on. But if the immune system is not doing a good job, it's going to make too many cytokines. Too many cytokines make you hurt, make it so you can't think, give you fatigue, make you hurt all over, interfere with your hormonal systems, make it so you can't sleep, right? So Lyme symptoms are too many cytokine symptoms, okay? Now, if you decline, you have to ask the question, is it necessarily Lyme, or could something else be triggering those cytokines, right? In somebody that was previously treated with either herbal or prescription antibiotics, even years ago, you are at extremely high risk of developing too many yeast in your intestines. And if you do get too many yeast in your intestines, your immune system is going to react by making too many cytokines. Okay, so too many yeast in your intestines can give you a syndrome that makes it look like your Lyme came back. All right, so how do you figure that out? Well, you look at things like, are you having increased sugar cravings? Are you having a lot of intestinal gasiness and bloating? The toxins that are released by yeast in your intestine interact with your skin and can give you pimples and acne. They may even give you eczema type rashes. Okay. You may develop difficulty swallowing. Sometimes yeast will make it feel like things are getting caught here in your food pipe. Women can get vaginal itching, vaginal discharge. And so I go through those. I ask those kind of questions. And if there's anything that might suggest yeast, I'll treat for yeast. Okay. There are also times I'll talk to a person and I think, gosh, you've been doing so well until recently. And even if I can't find any symptoms of yeast, I'll treat for yeast. And 80 to 90% of the time, people get better. And my yeast treatment would be usually diflucan, 200 milligrams one time a day for 30 days, nystatin, 2 pills twice a day, and usually probiotics, okay? And I cannot tell you, 80 to 90% of the time, treating yeast is all I need to do. And this, what looks like a horrible relapse, just dissipates, goes away if you go after the yeast. So talk over with your healthcare providers and see if they can help you figure out if this might be too many yeast leading to this kind of a decline. Okay. All right. Thanks for the question, Denise. Wow. Where do we get? 5:33 already. Listen, that's it. I've got to get going here. As many of you know, I have my 2 Basenjis who are snoring loudly under the desk, but they're going to start bugging me here in a little bit if I don't get them out. So it's time to go exercise my Basenjis and then to exercise me. Later on this evening, I will create a synopsis of this webinar, as well as do a quick edit to the video. Look for an email tomorrow morning announcing that it's ready and that you can view it. If you happen not to get that email tomorrow morning, usually by around 9 or 9:30, if you go to the webinars page at treatlyme.net, scroll down to the recording area, you can find it live there, okay? You will also be able to sign up for next week's webinar. And then I appreciate it if you can share this information with everybody. Send out my recordings, send out my requests for signing up for these webinars. I'm trying to reach as many people as possible, all right? Thanks, everyone. Good night. See you next week.